Good morning, everybody. Dr. Brace here, and today is Facial Plastics Friday. I'm going to be continuing our series on Botox, the good, the bad, and the ugly. Today, talking about the bad and the ugly. Just as a quick recap, last week we talked about where I like to put Botox for cosmetic lines, and that would be the forehead, the glabella, and the crow's feet, as well as dimpling in the chin, or the DAO, depressor anguli, muscle that pulls the corner of the mouth down. In the questions, somebody asked me about masseters. That was a good question. I do sometimes place it out here on the masseter to help narrow someone's face. That's a bit different than treating lines. It's really causing atrophy, and we use that for functional reasons as well, for bruxism and for migraines. But sticking strictly to kind of treating lines, today I want to talk about the bad and the ugly. And so how do I define the bad? The bad for me would be getting a nice cosmetic result with a terrible functional result. And so where I do not like to place Botox for that, or Xeomin or Dysport for that reason, would be the under eye, number one. So the muscle that goes around your eye is the orbicularis oculi muscle. It lets you squint. We treat the outer portion of it for crow's feet. Often people will come in and ask me, can I have my lines here treated? And the answer is, yeah, you can treat them, and a lot of people do, but you'll probably hate the way it feels. And why is that? This muscle that goes around your eye squeezes and keeps your eyelid tight against your eyeball. If you weaken it, it will roll your eyelid out even a millimeter, fraction of a millimeter, and you'll feel like you have wind on your eye all the time. And so the only time I ever really treat that muscle in that area would be somebody with blepharospasm, somebody with a hyperactive muscle to help calm it down. And that's often seen after Bell's palsy. But for cosmetic reasons, if you have lines in your lower lid, really a lower lid blepharoplasty or CO2 laser would be the right thing to do there, because you'll get a functional problem which will feel awful. The second bad where I don't like it is kind of in the upper lip, in this area. You should never put it in the mid-face at all, nasolabial fold, because it'll drop your smile completely. But people often ask about upper lip lines or a lip flip. And again, the upper lip has a muscle that goes right around it, actually your whole mouth, and that's the orbicularis oris muscle. It's a sphincter muscle that lets you purse your lips. And so if you weaken it, you're going to lose function. You won't be able to say your O's, you won't be able to drink from a straw, you'll have trouble with some of your speech, and then if you have a significant other that you're kissing, it will feel weird or it won't work properly. And so upper lip lines, people often ask about filler or Botox there. I hate both of those there. The thing that I love is CO2 laser. It will flatten this without adding volume, without giving you a weak lip, and I think gives you a better, long-lasting, more natural-looking result. Lip flips have been pretty popular on Instagram and on social media, where you place the Botox or the neurotoxin on the border of the lip, and it will help evert the lip and show a bit more lip. And it gives a really nice, subtle cosmetic result, but it causes the same lip weakness, where you will come back saying, I like the way it looked, but I hated the way it felt. So I usually try to talk people out of that, discourage them from doing it because of that reason. And then the other place where I don't love Botox would be in the neck. So a lot of people will treat the platysma muscle. This muscle that gives you those lines, will treat their bands with Botox, or we'll do a Nefertiti neck lift, where you place it where that platysma is, just under the jaw, to help give a little bit of a lift and a tightening effect. It's a subtle result for the Nefertiti neck lift at best. It does work well on the platysmal bands, but what I often see when I've done those treatments is people get a weak lower lip. The platysma muscle comes up and inserts into these lip depressors, and you'll get this asymmetric smile if you have asymmetric bands in your neck. If you put more units on a big band on this side and you don't have one on that side, you'll end up with a crooked lip in many cases. And so I do not like placing Botox in any of the orbicularis muscles around the eye, around the mouth. I don't love it in the neck, because again, there are better strategies to use to help with that. And those are the bad. Now the ugly. The ugly is basically when you get a complication from Botox. And I'm sure anyone who's been following on Instagram some of the complications recently, you've all seen the eyelid ptosis. Ptosis is when a muscle or a structure drops, and an eyelid ptosis is a droopy upper eyelid. You can also get a droopy eyebrow from too heavy in the brow, and that's called a brow ptosis. And so the ugly is when you get an unintentional consequence of placing the Botox in the wrong spot. It gets the wrong muscle, and you get a droopy kind of look. The great thing about that is that it's temporary and none of it's ever permanent, but it is 3 months of a hassle for the patient of looking like they've had a stroke. The other place where I would say is an ugly would be if you are treating masseters or crow's feet and you get too far medial and you get the zygomaticus major muscle, you're going to get a totally dropped lip, and that will make you look like you have Bell's palsy. And so you have to make sure that your injector knows what they're doing when they're injecting Botox, knows the danger zones to stay away from, and knows the other options for treatment. I love laser on the upper lip. I love laser on the lower eyelid to treat those areas because it does not have a functional consequence, and it does not cause a change in the volume of that structure. You want to keep the facial volumes balanced, and you don't want to treat everything like a nail. If all you have is a hammer, you have to recognize when the right tool may not be something in your toolbox, and you may have to use a laser or something else. So here are some pictures of the complications that I mentioned. I'll show the brow ptosis as well as the eyelid ptosis, and you can see what a crooked lip looks like if you do a Nefertiti neck lift or are treating too heavy on the platysma. And that's it for Facial Plastics Friday. If you have any questions, send them our way, and everybody enjoy the weekend. Bye-bye.